Addiction involves a complex interplay of brain circuitry, genetics, the environment, and an individual's life experiences.
It is characterized by the inability to abstain, impairment in behavioral control, cravings, diminished recognition of significant problems, as well as a dysfunctional emotional response. Addiction can take many forms, from drugs and alcohol to gambling and overeating. The root causes of addiction can vary from person to person, but often they are associated with emotional distress, such as anxiety, depression, or trauma. The societal effects of addiction are far-reaching, influencing not only the individual but also their families and communities, contributing to crime and homelessness, and burdening the healthcare system. The brain's reward system is designed to reward behaviors that promote survival, such as eating and reproduction.
When we engage in these actions, our brains release certain chemicals, creating feelings of pleasure or satisfaction.
However, addictive substances hijack this system by triggering the release of these chemicals in excessive amounts, creating an intense feeling of euphoria. But with prolonged use, the brain adjusts to these high levels of chemicals, requiring larger doses for the same effect, leading to addiction. This process underscores why individuals continue to use substances despite harmful consequences, as they're chasing the reward feeling that their brain has connected with the substance.
Neurotransmitters are the body's chemical messengers, transmitting signals across synapses in the brain.
A key player in the reward system is dopamine, a neurotransmitter heavily associated with pleasure and reward. When one takes drugs or consumes alcohol, these substances interfere with the way neurotransmitters send, receive, and process signals. Specifically, they overstimulate the dopamine system, releasing 2 to 10 times the normal level of dopamine and producing the intense feeling of pleasure or high. Over time, the brain adjusts to these excessive levels and produces less dopamine naturally, leading to dependence on the substance to feel pleasure or prevent withdrawal symptoms, ultimately resulting in addiction. Substantial exposure to drugs and alcohol can cause changes in the brain, a process often referred to as rewiring. Essentially, these substances can alter the brain's fundamental structure and the way it functions. Both the physical connections between neurons and the strength of the signals they send can change. This perturbation in the neural circuitry can lead to a rise in dependency, as the brain gradually adjusts to the presence of the substance to maintain normal functionality. Consequently, it can become challenging to abstain without suffering withdrawal symptoms. Such physical changes also make it easier for relapse to occur, even after prolonged periods of abstinence. The harms of drug and alcohol addiction extend far beyond the individual. Physically, addiction can lead to severe health problems, from heart diseases to liver failure.
Psychologically, it often co-occurs with mental health disorders like depression and anxiety. Socially, addiction can strain or break relationships, and may also lead to exclusion or stigmatization.
For instance, John's addiction started affecting his ability to function at work, leading to job loss. Furthermore, his continual substance use caused distress in his relationships, leading to isolation. In essence, addiction can pervasively infiltrate every aspect of an individual's life, causing widespread harm and disruption.
Recovering from addiction is possible with the right treatment and support systems.
Several approaches can be employed, including behavioral therapies, medications, and mutual support groups. Behavioral therapies help change harmful beliefs and behaviors related to substance use, and enhance life skills to handle stress and environmental cues that may trigger intense cravings. Medications can be vital to managing withdrawal, preventing relapse, and treating co-occurring conditions. Support groups, such as Alcoholics Anonymous, provide a community for people who are recovering. For instance, Sarah, a recovering addict, got therapy, used medications, and is a part of a support group, which has immensely helped regain control over her life.